Everyone happy we go ahead with this?
The operating theatre, a place of hope and fear.
A lot of people are really intimidated and really scared of coming into hospital.
I'm starting to freak out a little bit.
You know I love you, don't you?
Of course I do.
For the first time ever, an NHS day surgery unit and its staff have been rigged with cameras.
You've got a camera on your head.
I'm going to be filming you.
It's never a boring place to be.
Capturing a hard-working, close-knit team.
Welcome to our theatre.
Just had a birthday. Did you have cake?
Yeah.
Did you?
Yeah.
We'll get you back to the ward for a nice cup of tea.
Performing hundreds of complex operations every week.
I like fixing things.
Hey!
It gets your heart rate going.
Whoa, 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 whoa.
Can I have some help, please?
Changing patients' lives.
Stand clear, please.
Inside the operating theatre.
Look at that. That must be a world record.
I don't like vomit.
Well, that makes you squeamish.
It doesn't make me squeamish, I just don't like vomit.
The thing that really makes me squeamish is probably, the veins. Having varicose veins removed, varicose vein surgery, it's just horrible. It's like earthworms coming out of the legs. It's horrible.
It's hardcore, isn't it?
Yeah, it is hardcore.
Done.
I'm not squeamish, but smells can turn my stomach sometimes. Burning flesh is an awful smell.
You don't want to inhale it. You've got a lifetime of this.
Bum procedures
Yeah,
aren't all the most pleasant. I try not to get too close.
I think sometimes as well, when patients are a bit relaxed in recovery, they're very relaxed sometimes, and also some of the staff.
Yeah.
Morning. Hello. Hannah Cole. Would you like to take a seat in the waiting area, my darling? Thank you.
I'm feeling apprehensive, a bit nervous. I mean, I was a bit ill this morning, actually, I'm not going to lie. But but I think it's just the nerves.
Yeah. Pop the bag down.
Yeah. When I went in for my assessment, I had my bloods done and I nearly passed out. So that's how how nervous I am for it. So.
Do you want anything from the bag?
No.
I can't drink anything, I can't eat anything, can I? So
It's been 8 years that I've been suffering with these. My tonsils are absolutely massive, so I need to have them out. They are ridiculously sized. They're awful.
I think I'm nervous for you.
Oh yeah?
Yeah.
You're on my hand.
Huh?
On my hand. Hannah Cool? Yes. Hello, my love.
Hello.
My name's Betty.
Hello.
Good afternoon today. Do you want to come in?
Yeah. Because they're so big, I've had a lot of difficulty sort of like breathing, swallowing. They're quite difficult to live with, and they've gotten so bad that it was just like, no, I need to have them out now, really.
Have a seat, darling.
Oh, thank you.
Okay.
Yeah. My fiancé, George, he's come with me today. But yeah, he's got the the job of looking after me after, but he'll be quite happy because I think I won't have a voice after this, so that's quite a good thing for him, so I won't be nagging him all the time. I could go to sleep right now.
Save it for the operation.
Yeah. I'll be doing plenty of sleeping after, I think.
Yeah. We both work as funeral directors. I deal with all the body prep and carrying coffins. She sometimes helps me in the mortuary.
I work with my partner and we prep the bodies, and we sometimes have to obviously wash them, dress them. We have to get them ready in their coffin and things like that. People ask me, why are you doing this? You know, like, what kind of person do you have to be to have this job? But I think it's quite an interesting job to have.
She'll be quite easy to look after in the coming week.
Yeah.
So you'll just have to shout to me if you need me to do anything.
Well, that's not going to happen, is it? I'll have to just like bang on things.
With my job, I've always had, I suppose, not really a morbid curiosity to call it that really, but I've always been interested in anatomy, because before I did this, I wanted to be a doctor. And at college I did forensic science, which was really interesting.
I have the camera ready.
Consultant ear, nose and throat surgeon Mr McPartlan will perform Hannah's tonsillectomy.
Morning.
Hello.
Morning. Hannah.
Hiya.
Hi, David McPartlan. I'm the consultant doing the operating list today. What we're going to do, we're going to get your tonsils out for a couple of reasons really. One, that they're of different size, which probably is nothing to worry about because it's been a gradual thing over 7 years or more. The other more relevant factor is that they're causing you a lot of problems. We will send the tonsils off to be looked at under the microscope, just to make sure that there isn't anything else going on there. Okay. In the case of tonsillectomy, one of the biggest issues after the surgery is the pain that the patient experiences. This can go on for several days. I often say to my patients that they will probably regret ever having met me for the first few days after the surgery. It's not a very nice operation, if we're honest. It's painful.
Great.
Yeah. So you need to be prepared for that. It's going to be quite painful afterwards.
Good morning. Yeah, Nick Cooper.
Okay. Can you both give your hands a wash with the sanitizer, please, and then just take a seat?
Like most people, I'm afraid of surgery as a risk, but there again, I know if I don't have anything done, then my life will be shorter than it otherwise might be. Thank you. At the age of 70, I feel I've still got loads of life left, and I want to be fit enough to make the most of it. I've got 2 children, and I've got 2 grandchildren. Not too bad. Just a bit caffeine deprived.
Our son lives in the United States, and because of Nick's condition, we were going to go over next year, but now we feel that we can't risk that. And our daughter is married and lives in London with 2 children, who are now 7 and 4 years old.
Nicholas Cooper?
Hiya.
Hello.
Okay, Janie. We look after our grandchildren. We have to go down to London to do that. So that's another reason why I need to be fit.
Okay, goodbye.
Bye, Janie.
Okay.
I'm being looked after.
Bye.
Bye. Bye, darling. Bye. I'm believed to have a sticky heart valve. It slows me down. The condition stops you from doing all the things I'd like to do.
We're just going down into bay 3.
Right.
It's walking seems to be the main problem. Plus, he doesn't lift the grandchildren up or anything like that, which is a pity.
Okay. If you take a seat there for me, I'll just grab your paperwork and I'll come and go through your admission process.
Okay.
All right?
Yeah.
Nick was referred to a cardiologist 6 months ago.
I've been in denial, and I probably had an idea there's something wrong for some time, but I hadn't really thought about mortality so much before that, but it did give me a shock.
Hello, Mr. Cooper.
Hi there.
Hello.
Nick is having a probe put down his throat to investigate whether he's going to need heart surgery.
Okay, I'm Jo. I'm one of the theatre technicians, and this is Crystal. Okay.
Hiya.
I'm just going to check your paperwork, and then I just need to pop a small cannula into the back of your hand.
Okay.
Obviously, it's worse for him because he's the one going through it, but, you know, we are both anxious about it, obviously, and but hopeful.
So you've been having trouble then? Is that why you're coming in?
Yeah, it's
with,
just sort
symptoms?
of tight-chestedness. Yeah, I've got some sort of heart irregularity problems.
Right. Okay.
Right.
Okay, my love. Okay, you're going to have a sharp scratch coming now. Lily.
For me to let go?
Yes, thank you. That's lovely.
A defective heart valve can lead to a stroke or even heart failure.
All right, then we'll see you in a bit then. Okay.
Okay.
Thank you.
I've always been a bit concerned about my health because my parents didn't live a long time. You know, you start thinking about Grim Reapers and so on, don't you?
Hannah Cool needs surgery to remove her painful and inflamed tonsils.
You're going to need to take the painkillers we give you regularly.
Yeah, that's fine.
Don't wait until you're in pain.
No.
If it's time for a dose, take
a dose, yeah.
Okay. It is important to be honest about what the procedure involves, what the risks are, and what the likely post-operative experience is going to be. It's a very vascular area, so we do everything we can to stop the bleeding at the time, but if you pick up infection, there's a chance of bleeding. So overall, probably about 5% will have some sort of bleed. So we don't want that to happen.
No.
So we do everything we can to prevent it and
So
to stop any bleeding.
are you going to like cauterise the blood vessels?
I'll use some cautery to stop the blood vessels. But because it sits on that bed of muscle, and as we get older, you've had a few infections, possibly low-grade infections, it tends to be a bit more stuck down the capsule to the muscle.
Oh, Jesus.
And that's what causes the pain as we sort of peel it off the muscle, because you're basically leaving a raw area behind, which takes a while to heal. Any other questions?
I think that is it. Yeah.
All right,
Good. Yeah.
Good. See you shortly.
Good. Yeah, thank you.
Got the week off to look after her, which I'm not sure how much looking after she's going to need, but so I'll be there for her. And I'm going to have to figure out some meals to cook for her. I'm not the best cook.
Follow Abby.
Yeah, that's fine.
Okay.
Bye,
and we
George.
will see you. We'll see you soon. All right.
Yes. Thank you.
Okay.
Oh God. A normal mouth, really. I suppose that's all I hope for, really. So I can, But I'm so glad they're coming up.
What do you do?
Police officer.
Are you?
Wow.
Wow.
Yeah.
My driving's not the greatest.
Yeah, watch out.
You're not a traffic policeman, are you?
Oh, no.
Oh, that's all right then. I'm sorted. As I might be fined.
Nick Cooper is in hospital to find out if he needs major heart surgery.
Morning. Mr. Nicholas?
His consultant is cardiologist Dr. Bilku.
Mr. Cooper, good morning.
Nice
Dr.
to see
Bilku.
you again.
How are you doing?
All right, thanks.
Good, good. Right, so you're here for your camera test to evaluate the heart valves in more detail.
Right.
So the way we do this is spray the back of the throat, sedation through that cannula, and then whilst you're on your side, once you're a little bit sedated, we'll get you to swallow a probe that goes into the back of the food pipe. I won't force the probe, I'll get you to swallow.
Okay.
And then once the probe is down, we give you a bit more extra sedation, and then we just do the procedure.
Okay.
For patients with a heart condition, they get extremely anxious and worried about what may happen to them. Therefore, it's very important to do tests like these. The procedure can be very uncomfortable, but with Nick, it's really important to confirm the diagnosis and its severity, as that will help decide what needs to be done. The benefits are to clarify and identify any structural heart problems. The risks of the procedure are small. The benefits outweigh the risks, but the risks are as follows. There's a 1 in 10,000 risk of causing a hole in the food pipe.
Right.
If that happened, you need an operation to fix that.
Right.
I will tell you later on today what we found.
Right. Okay, that's good. Thank you.
Left untreated, statistics show that there is an increase in mortality, so that 50% of patients can be dead within 2 years if untreated. Great, see you shortly.
Okay.
Bye for now.
It could affect my life completely, couldn't it? But what it'll mean is, if I can get 10 years, 15 years of good health, this will make all the difference.
All right, so Crystal will take you down and we'll see you in about an hour.
Okay.
All right.
All right.
Take a seat, Mr. Cooper.
Right.
Mr. Cooper, before I lie you down, this is the topical anaesthetic spray. It has a slightly unpleasant taste, allegedly. I've not tasted it personally myself,
Right.
although some people like it, but we shall see. Here we go. Open your mouth for me. Okay. If you can just swallow on that for me. And we're going to lie you back, okay?
Okay.
Now, if you roll onto your left-hand side, treat this like a couch or a bed at home, okay? Are you comfortable like that?
Yeah.
Yeah? Okay. At all times, keep your chin forwards onto your chest. You'll find that you'll tolerate the probe better. If you open your mouth wide for me, and now close your mouth and just bite on that, okay? Wonderful. I'm just going to give you a little bit of sedation. Okay. You'll feel a little bit drowsy in a minute or so, okay?
Nick will be awake throughout.
So this probe is going to shortly go into the mouth, hit the back of the throat, and then I'll ask you to swallow. Okay. Can I have some gel, please? Just going to go over your tongue. Just get used to the feelings. It's going to hit the back of the throat in a moment. So just relax for me. Swallow for me there. Big swallow. Okay. Try again for me. Okay, just relax. I'm going to take the probe out for 1 second. We'll try that again in a moment, okay? It goes completely against a natural reaction for the body to swallow something of that size. But it is very important not to force the probe, as it can cause rupture of the food pipe. Hit the back of the throat, here we go. Now, swallow for me there. Big swallow. Well done. Probe is down. And we're just going to take some pictures now. Can you store that image, please? That's fine. Colour on the mitral valve. The resolution of the pictures is much better than the normal ultrasound scans that we do from outside the chest wall. So it gives us much better and finer detail to confirm a particular abnormality that we're looking for. In some scenarios, it can be a life-saving procedure. This is the area of interest, the aortic valve. It looks a little bit thickened and calcified, reduced movement of the leaflets. Just improve on that view. Doing very well, Mr. Cooper. Just another few more minutes to go. This bit might be slightly uncomfortable. Here we go. Just going into the stomach. Can you zoom in on the aortic valve, please? Okay. Can you store that, please? Last last couple of pictures, Mr. Cooper. There's a jet there. Can you store that, please? So that's severe. Just going to take the probe out now. Here we go. Bit of atheroma there. All finished. Well done. Okay. Just relax. You did very, very well. You're going to be a bit sleepy. I'll come and chat to you on the ward a bit later.
Yeah.
Okay?
Yeah.
You just relax, take it easy, okay?
Yeah.
All right, see you later on.
Okay,
Yeah.
I'm going to take you through to the waking up room now, recovery, just
Yeah.
for a little while.
Yeah.
Then we'll get you back to the ward and have a nice cup of tea.
That sounds good, yeah.
I am looking forward to seeing him. And I think he'll be looking forward to seeing me as well.
You know, she's always been there for me for these last 43 years, and I do value that.
Hello.
Hello, you
My
alright?
name's Irene Brown. Yes, I've got an appointment.
Lovely. So if you just take a seat, they'll
Okay.
be with you shortly.
Thank you. I'm apprehensive about having this done. It did scare me when it first happened because I can't see. I'm already getting flashing lights and not being able to see for maybe 10 minutes. I just want to go and get it done. At the moment, I can't recognise faces very well. They're blurred.
Irene Brown?
Yes.
Hello.
Hello.
Come on through. Are you all right there?
Can I come up with it?
Can you can come. Yeah, of course you can.
He's not staying.
He's isn't he? Is he getting evicted? Right, we're just going around this way.
My husband Tony, we're coming up to about 30 years now. And I met him when I was working in an estate agent. It wasn't very romantic actually, because I thought he was somebody else. I thought he was a friend of mine who is Spanish. Then I realised the accent was a Geordie accent and not a Spanish accent.
Okay.
All right.
Cheers, Pet.
You're welcome. See you a bit later.
See you, Mrs. Take care.
See you in a minute. Well, I'm not going to go anywhere, am I?
Oh, bless your little heart.
Sit and watch the world go by.
Okay.
Bye-bye.
Right. Let's get you checked in and get you started, shall we?
Yeah.
So I should probably start off by saying my name's Karen. I'll be one of the nurses looking after you this afternoon.
Oh, good.
Okay?
Are you the one holding my hand?
I'm not the one holding your hand, but there is another selection of lovely people that will come out and do that for
Have
you
you got
as well.
Sasha G. Still? He'll do. He can hold my hand.
Oh, well.
But he's dead, isn't he? So that's not good. Okay. If I don't get this operation, I assume that my eyesight in my left eye will get progressively worse. I should imagine it causes blindness in the end.
So, left eye. Start you off with a little bit of anaesthetic, okay?
Yeah.
Can be a little bit tingly to begin with. And then there's a couple of dilating drops as well to help make your pupil big ready for the surgery.
It's like making a cake.
Yeah. And I was doing that yesterday too.
Oh, so was I.
Where are you? What did you make?
I made a courgette cake for my granddaughter.
Yes.
And it's only the second cake I've ever made.
Is it?
And she phoned up and left a message and said, Grandma, hope you're okay with your operation.
Oh, bless. Bless a little heart.
I've got 5 cats and 2 dogs and 5 grandchildren, and they're very sympathetic, so that they would know what Grandma was going through.
So basically what will happen, we'll go and get everything, make sure it's all ready, and then when it's time, we'll get you through to theatre, and then they'll get started when they're ready.
Will they actually take the eye out of the socket?
No,
No.
No. It can't come out if it's going back in again. But it's all done from just holding your eye open, and we go from the outside in, so nothing comes out or anything
somebody's
like
there.
that. They'll hold your hand, they're going to look after you. You'll be fine.
I'm nervous about having it done, but I'm not.
No, that's okay, don't worry.
I have had 2 cataract operations before. I had them done when I lived in Spain, but that was 12 years ago, I think. And one of them has started to leak, causing fluid to go into the eye, causing me to have mist in one eye.
Ophthalmic surgeon Mr. Gunda will carry out Irene's operation.
Hello, so you had the surgery in Spain, is it, you said?
Yes, and it was at least 12 years ago.
You know what we are going to do, because the gel is coming in the front.
Yeah.
Yeah, I think there was some problem during the surgery. So that is causing problems at the back. So we are going at the back and clearing all the gel.
Couldn't give me some false eyelashes while you're at it. I don't want to end up not being able to read or write or whatever. So it's a necessity for me to have it done.
My name's Tracy, that's Claire.
Hello, I'm Claire, you right?
Hello, Claire.
And this is little Ange.
Where? She must be small.
There she is.
You're under the bed.
Every day, there's 5 operating theatres in action at the day surgery unit, covering 25 specialisms.
No hair removal required, no critical steps on the surgical side, any on the anaesthetic side?
Hannah Cool is about to have surgery to remove her tonsils. It's an unusual operation to have as an adult, but she's been in agony with them for 8 years.
Everyone happy we go ahead with this? Thank you. Her tonsils had become inflamed and infected on so many occasions that they were chronically enlarged, and as well as the pain she got during acute episodes of infection, the enlargement of the tonsils was affecting her swallowing. Thank you. Gag is open now. Is everything all right, airway-wise? It was once described to me that the sort of person who might be interested in being an ear, nose and throat surgeon is the same sort of person who might enjoy the challenge of redecorating their hallway through the letterbox. Scissors then, please. Thank you. If you think of the neck, every structure that's essential for the maintenance of life is passing through that narrow space, and it's in that space and the sort of cavities of the ears and the nasal passages that we're operating. Curve negus, please.
Yeah.
Thank you. Scissors, please. And then a tie. So that's right tonsil.
The right one, yeah.
Thank you. Go on to the other side. Yeah, that's it. The biggest risk following tonsillectomy, the one we worry most about, is bleeding. We will often use ties or ligatures to tie off the larger blood vessels and stop them bleeding to minimise blood loss during the operation and also reduce the chance of bleeding after the surgery. Okay. Lovely. So you noticed the jaw was out there. I just popped it back. That's why I always check at the end. Her jaw had actually dislocated by putting the gag in, but it's popped back in. So that's good.
The operation to remove Hannah's tonsils has taken just under half an hour.
Oh, you're losing your pack. Yes. Oh, Christ.
What are you doing, Melanie?
I'm making some minor adjustments to Mr. McPartland's trousers.
It's all above board.
Yeah, it looks it.
There you go.
Can you warm your hands up?
Sorry.
You never know, woman.
We're a close-knit team in theatres, and there's usually a helpful pair of hands ready to hoik your trousers up and prevent further embarrassment.
Nick Cooper is waiting to find out whether he's going to need open heart surgery.
How are you doing, Mr. Cooper?
All right, yes.
How did you find that experience?
I suppose I can remember some of it, not all of it. Did it go all right?
It went very well. So basically we found some information which supports what we thought.
Yes.
So the aortic valve is certainly thickened, and the pressure measurements that we made across it does suggest that the valve is borderline severe. Certainly the heart pumps well. The
Yes.
other valves are fine, but it's just that one valve which
Yes.
is thickened and doesn't open so well.
Yeah.
It's functionally behaving as severe enough that I think that is contributing to your symptoms.
Yes.
You will need an operation.
Yes.
The question is when.
Yeah.
And obviously if your symptoms are getting worse, then I think the time probably has come that we should refer you.
Okay, I'm fine with that.
Okay.
Yeah.
Is there anything you'd like to ask me?
No, I'm glad you're able to get to see things slightly more clearly with
Yes.
on this procedure.
No, definitely. And I'll see you in due course.
Yeah.
Take care. All the
Thank
best.
you.
Bye for now.
no operation was without risk, but I do know that I would like to have it done as soon as possible, actually. I'm quietly confident that they know what they're doing. They've done it lots of times before, and other people have had great success having had similar operations, so I'm holding on to that.
How you doing?
All right? Yeah? Oh, a bit of a blur, really.
Yeah. You've still got your shoes on?
Yeah, it's always a bit odd, really, yeah. I've got these sort of silly clothes on, plus my underpants. I'm decent, really. And it wasn't as bad as I thought it was going to be.
Yeah.
It was okay.
Okay. Now both Nick and I know there is a valve problem. It's the first step to knowing exactly what's wrong and having this operation. And really, we hope the sooner it's done, the better.
Enjoying the sandwich?
Very much,
I can
thank
just
you.
slip
Yeah.
behind you and just...
What is it?
Second crest. That is sort of like the
Oh, that's right up his street.
perfect.
He'll be coming here for lunch every day.
One egg and cress sandwich on brown.
It is perfect like that.
But your throat's all right?
Yeah, I thought it was going to be
Does it feel all right?
Yeah,
Yeah.
not too bad at all.
I do believe with this valve replacement that it's usually completely successful, and people say, oh, I've had a new lease of life and so on, so that would be really nice.
Hello again. Hello. Hello, this is Laura. She's going to take you through and look after you.
Irene Brown is going into theatre to have a vital eye operation.
Have you had this done before?
I had 2 cataracts done in Spain 12 years ago.
Oh, wow.
She's been having problems with her left eye and now needs surgery.
Right, hello, Irene.
Hello.
Hello. Over you come.
If it goes according to plan, it will take away the fuzziness in my eye and it will give me back clearer sight.
How many years were you in Spain then?
20.
Oh, lovely.
Oh, I'm going back a long way. I'm retired for a living. I worked as a secretary. Then, when I had my 2 children, I ran a dog boarding kennels and a very small livery stable up in Kent.
So I'm going to pop a blanket over you now, all right? Because it is a little bit chilly-willy.
Which is the one looking after me?
Me.
Oh, lovely.
So what are your cats called that you've got now then?
Primrose, Marigold, Phoebe, Dulcie, Oberon. Oh, I've only got 5
She's only
now.
got 5 now.
What, cats?
Yeah. People used to leave them at my gate.
Irene's surgeon is Mr. Gunda.
I'm going to put some drops. This will numb your eye, yeah?
Yeah.
Yeah.
Have you just got cats then?
No, I've got dogs.
How many dogs have you got?
Only 2 now. I had 8.
Oh, okay.
I've never not had lots of animals. I used to have donkeys.
Did you?
Goats. Horses.
Irene, next thing is I'm going to put a clip on your eyes, yeah?
Yeah.
Look down and look up.
Okay, you can squeeze my hand for this bit because you might stick it away.
Look up and left, here towards me. Look towards me here. Yeah, just be like that now.
Irene's given some local anaesthetic.
You will feel a bit of pressure, yeah? That's the worst bit.
Is it gone dead then?
Yeah, its whole face goes numb.
Yeah.
Mr. Gunda is performing the operation under the watchful eye of his mentor, Mr. Saeed.
This surgery was essential for Irene. If we don't do it, Irene will go blind and she will lose her sight altogether.
Have the lights down, please.
Mr. Gunda needs to break up and remove a gel-like substance that's impairing Irene's vision.
You're cutting something that's not clearly visible. Okay, go for it. So it's a whole different world when you get inside the eye. You see features such as birthmarks on the retina. Okay, that's all done. Good. Okay, so we can tell that previous surgery in Spain was complicated. Yeah.
So and then vitreous started coming. I cleared it off. See, gone.
Good.
As they clear the gel, Mr. Saeed notices something concerning.
I think there is
tiny bit.
Might be something in anterior chamber here. There is some there. See? Okay, just put your retractor back in, and yeah, just clear all that.
The last pieces of the gel have to be taken out from the front of the eye. One mistake could damage Irene's eyesight permanently.
Stop. Okay, I think that should do.
Yeah.
Don't you think?
Yeah, I think so.
Okay, perfect.
You finished?
Yeah.
God, that was quick.
We try.
Just a minute, my dear. Just be lying like that.
I can't believe you've done it.
Right, Mum, come have a ride in this. Let's go get you that cup of tea.
Where is it? Oh, I haven't got one of these at home, you know. Here, yeah. I thought.
Mr. Brown, your procedure went very well. You okay?
Yes.
Okay.
Thank you.
Irene's surgery has taken nearly an hour.
He didn't take any of my brains out, did he?
No. Don't know what sort of surgery you think we were doing.
My head feels dead. Is it dead?
No. Sure. That's it, go. Sleep there. All right. I'll make you a cup of tea, all right?
Oh, yeah. Oh, that's lovely.
There.
Oh, that's what I need. Oh, lovely. Thank you. Hello.
How did it go?
Oh, brilliant. I was only in there for 40 minutes. And I heard everything they did.
Yeah.
And I could hear them just talking over me.
Yeah.
For them to look. Here she is. She'll tell you.
Oh, again.
She'll tell you.
So you tend to find when you take all that padding off, don't be too alarmed if your eye's a little bit stuck together because
I'm
stone
going to look
stuff
like
there.
Frankenstein's monster.
You
for a couple
won't.
of
You won't
days.
at all. You should look absolutely fine, but it's just don't be alarmed
If
if
they'd
you
given you
do.
a black patch, you could have been Johnny Kidd and the Pirates.
Yeah. I was very apprehensive, but now it's done. And it went very, very well. The surgeon said he was really pleased with it. I'm looking forward to being able to walk my dogs again and get back to a normal life. And also being able to watch the television without sunglasses on.
Right for me, Tiff, please.
Hannah Cool has just come out of theatre following a tonsillectomy.
Hello there. Hello. Hello, Hannah. I'm just going to pop a bit of oxygen on you, okay?
Okay, Hannah, you all right?
Yeah.
Yeah?
Just feel like a sore throat.
Yeah, it's going to feel a bit sore, okay?
Yeah, no.
Have you got anybody on the ward with you?
Yes, my fiance George.
Oh, lovely. Got a wedding booked?
Yeah, Halloween.
Oh, why Halloween?
Because we love Halloween and we're like party people.
Okay, shall we get you back then? There she is.
How you feeling?
So, did you miss me?
Yeah.
Do you want to look at my mouth?
I do actually. That's it. Oh wow. Do you want to see it? You want me to take a picture?
Oh wow, look at that. Hello.
Hello. Oh, you're smiling. That's very good.
Yeah.
So, yeah, 2 weeks off. There will be some times that's uncomfortable, even if you're feeling good now. So just be prepared for that. Eat and drink as normally as possible.
Yeah.
Take the painkillers regularly. All right.
Yeah.
Okay.
Thank you very much.
Jolly good.
Cheers.
Right. Bye now.
Nick is waiting to have open heart surgery to replace his defective valve, but he could need a triple heart bypass. After her tonsillectomy, Hannah's painful recovery lasted 2 weeks. She was well looked after by her fiancé George and is now back at work. And Irene's operation proved to be a complete success.
Bye-bye. Adios, amigos.
A recent eye test showed that she now has almost 20/20 vision.